Welcome to Where Parents Talk. My name is Lianne Castelino. Our guest today is a lawyer and a best-selling author. Gina Mundy focuses specifically on childbirth cases. Gina Mundy joins us today from near Detroit, Michigan. Thank you so much for being here.
Oh, Leanne, thanks for having me. I'm excited for our conversation today.
It is both a really interesting area of work that you're in. It's also scary in many respects, but heartening in other respects in terms of what parents need to know. So let's start, first of all, Gina, with what was the catalyst for you to focus specifically as an attorney on childbirth cases?
I wish I had a better answer. It's very boring. I needed my first job out of law school. Literally, that was it. They don't teach you about this area of law. I went through 3 years of law school. I worked at law firms. I never even knew this area existed until I was looking for, like in the paper back then, because it was 21 years ago. And I stumbled on it. But it was kind of concerning because I was hired in, but I was hired in to a team of over 20 people. And this is all they did were childbirth cases. And just so your audience understands what a childbirth case is, it's a case involving the birth of a baby and something goes wrong. It's a mistake, it's a complication, but baby's not born healthy. Babies pass during childbirth, or a mom will pass during childbirth. So I had just gotten married, having a baby was on my radar. And I remember going, oh my goodness, I want to have a baby. I don't want this to happen to me. So I stayed in to learn about this field to make sure, again, it didn't happen to me.
More than 20 years ago, what struck you most back then, if you can recall, as you started to learn more and more about childbirth cases specifically?
The most shocking thing by far were the different opinions of the doctors. So I would get a case in and something went wrong, just meaning baby, it was either passed away or baby, was not healthy. When I say not healthy, I mean permanently not healthy, brain damaged, whatnot. But then I would talk to the doctors and they all had different opinions. And I couldn't believe it. I remember my first case and I retained one doctor. So when I retain a doctor, they're an expert in the case. So that means that they weren't involved directly with the care of the patient. They're coming in to look at the medical records of mom and baby and tell me whether this was good care or bad care. So I would have two doctors, and sometimes from the same hospital, two medical experts who reviewed the case and the records. And one would tell me, Gina, everything was done correctly. This is, this is perfect care. And I'd say, oh, great, thank you. And then I would, look at my other expert and say, okay, what are your opinions? And they were like, everything was done wrong. And they would just criticize every aspect of the care that mom and baby received. And it was like, what? But it was a very shocking thing to me that doctors could have such different, drastically different opinions. And early in my career, I started to ask them, why? Why do you think this? Another doctor thinks this. And to this day, even when I still ask that question sometimes, because I get such drastic, different opinions, they just dismiss the other one as crazy. It's the weirdest thing. It's I'm right, they're wrong. But I think it's good for everybody to understand that, because just because you may disagree with your doctor doesn't make you wrong, because you may go talk to another doctor and have a conversation and be more agreeable with how another doctor thinks. So it's very important to understand that.
So it's such an important point you're making because there's the medical opinions, the medical differences piece, but we are ultimately talking about a very intense period of time, backdrop, environment, situation when a woman is about to give birth. So, what are some of the more common mistakes or problems that you have seen in your years of research and observation and interviews and all the rest in terms of what can happen during labor and delivery?
That was actually another reason I stayed in this field. Just so you understand, the problems, the complications, the mistakes are literally the same ones that I have seen since February 2003. So as I progressed into the field, I picked up real quick that I would get almost like two different cases in, and they were so similar with what happened to the patient, except the patient had different names. So, yes, these are reoccurring issues, reoccurring facts that every parent must understand, even if you're a grandparent. Listen, I have three kids, 19, 15, and 9. I wrote this book for my kids because I want healthy grandkids. So grandmas out there, or if you have a friend, I have nieces and I have friends who have daughters pregnant and whatnot. These are so important to understand because if parents who are expecting understand this, if grandmas who are there understand this, it gives them a heightened sense of awareness. It helps them activate their intuition so they can make those good decisions. Because in my cases, families are so close to a healthy baby. They are one decision or minutes from a healthy baby. So understanding these common mistakes, I cannot stress enough to your audience. But let's get into it. Number one, the number one most common mistake, or I should say issue or fact in a legal baby case, is the drug Pitocin. Pitocin is a drug that is used to induce mom's labor. So basically, so these are the elective inductions at 39 weeks that you are becoming more common since 2018. And basically, well, Pitocin's always been around. It was just in 2018 they approved it for elective inductions, but medical inductions have been going on since February 2003. I'll just clarify that. But these inductions can be very dangerous. So it's very important to understand how to have a safe induction. I've seen the inductions gone wrong since February 2003. I've researched the drug. I've traveled the United States talking to different, doctors, nurses, midwives, residents about this drug. I've researched it heavily. So I did include a chapter in my book on how to have, a safe Pitocin induction. But Pitocin, so your audience understands, is like a synthetic oxytocin. Oxytocin is your body produces that naturally. And when your body produces that, that makes your uterus contract. Your uterus is like the home of the baby. Baby hangs out there with the placenta and the cord. And so when your body naturally releases this, that your uterus starts to contract, and then that kind of puts your body into labor naturally. When you use Pitocin, that makes your body contract, but not like a natural oxytocin would. While it's supposed to mimic your natural oxytocin, that's where people get into trouble, because if you are putting too much Pitocin into mom, that causes mom to contract. And listen, contractions, if you've ever been in labor, or if you ever heard another mom talk, or if you ever seen a mom in labor, watch a movie. Contractions are really hard on mom. And those are the natural ones. You get contractions on Pitocin, ouch. I mean, it's so painful. But here's the deal. It's not just hard on mom, they're hard on baby. Baby, when a contraction hits, basically it's home, your uterus squeezes down and all the oxygen is cut off to baby. Listen, completely normal. Babies are made to handle contractions. But when your contractions are artificial through Pitocin, that's when they can get into trouble. So if Pitocin's making you contract too much, that's just too much stress on baby. So anyway, so I go over that, in the chapter and whatnot, but that's probably Pitocin is in most of my baby cases. So it's very important to understand that. And it's a cascade effect. Your contractions are really bad. You get an epidural, and then you're not moving and it's just whatnot. But with that said, the flip side of that, a natural and all natural birth, I will tell you those cases are few and far between. Less chance of a mistake, less chance of a complication if you can just have a natural vaginal spontaneous birth, meaning no Pitocin. So, and if you do the epidural, that's one thing. But if you can skip the epidural and just go, that way, I'm telling you, that's the best way to go from all of these, from 21 years of experience. Number two, this one is so important that I don't think parents or anybody, grandparents, unless you're me, you don't really understand. Because I remember I'm a lawyer. I don't deliver babies. The cool thing about doctors and delivery teams, they get to see the good and the bad. I only see the bad. So, and not only do I only see the bad, I analyze the bad for years. These cases take years to go through the system, years of traveling, years of just so many discussions. Anyway, some number two, very common factor issue in the baby case. When there is a mistake or a complication, it is typically after mom's water breaks. So in the uterus, again, where the baby is housed, hanging out with the placenta, the umbilical cord. Placenta gives baby all the nutrients. The umbilical cord's like the lifeline from the placenta to the baby that, feeds the baby the nutrients and oxygen. And then everything is surrounded with fluid. So when that fluid drains out, that changes they call it the intrauterine environment. It changes the baby's environment and what's going on in there. But when you have a patient in labor, there's two patients, there's mom and there's baby. Mom is easy, right? Doctors look at mom and they're like, hey, you look like you're in pain. Are you okay? Mom responds, yes, I'm in a bunch of pain. Okay, where's the pain? And they have a conversation. They make a plan. They make a diagnosis. Baby, completely different. Baby is hiding inside mom in her uterus. So it's harder to assess how baby's doing. So when the flood of water comes out or mom's water breaks, that changes the intrauterine environment. But how it changes it, nobody really knows. So it's really important that if you are in labor and your water has not broken or, whatnot, or the doctor wants to break your bag of water, maybe to get your labor going, it's really important to ask, is there a medical reason why you want to break my water? Or are you trying to speed up my labor because you want to be home for dinner? So as a childbirth attorney, I've heard both. So it's really, that is just, I think everybody just takes it for granted, like, yes, break my water. Yes. I will be out of here faster. And I will finally, we're pregnant for so long. So if you show us this, okay, you're going to be holding your baby much faster if I break your water. It's very tempting, but it's a big decision. So that's, it's really important to understand. Another very common fact in my baby cases is a very busy labor and delivery unit. Babies come when babies want to come. This is not a scheduled, unless you're having a scheduled elective. See, even then, it doesn't matter. You still have the moms that are all rolling up in labor and whatnot. So when that happens, delivery teams get really busy. And you got to remember, your delivery team is responsible for bringing your baby safely into this world. In a legal baby case, it is the delivery team's care that is at issue and analyzed more than any other aspect of the case. So when you have a busy unit and they're running hard and they're running thin, it is important as a parent to have kind of an understanding of the important aspects of childbirth so you can work with your delivery team when they can't just be at your bedside. Okay. So that's probably one of the biggest things is busy labor and delivery unit, having a good understanding of childbirth so you can kind of work with your team and notify them. Because here's the deal. Think about it in life. Have you ever had one of those super busy days? You're so busy you can't even see straight. You're moving at the speed of light.
Mm-hmm.
That's a delivery team in a busy unit. And I know when I do that, I miss things. So now if someone tells me, Gina, you're missing something, the baby's heart rate's not doing great or, whatnot, I'm on it. But until, if I don't know, I don't know. So, be careful because you walk into a busy unit. If they ever want to give you an extra room, I mean, that's like red flag, and you gotta, be on it. But, those are some common mistakes. But, there's one part about what I've really been advocating for parents to have an understanding of. And, like we talked about earlier, baby's inside you. So how is your baby doing? So that really comes down to what we call the fetal monitoring, and that's your baby's heart rate. So your baby's heart rate is extremely important. And I keep saying this, and I got to stop saying this, but I don't know what's up with the medical community, but they want to keep the baby's heart rate and what it means to themselves. They are always like, this is medical information. And I'm like, what? No, it's not. It's my baby's heart rate. What are you talking about? As a childbirth attorney, the first thing I learned was to read how to read a baby's heart rate. It took me an hour. I can look at a baby's heart rate and I can tell you if baby's a rock star during labor or if baby's struggling. I have testimony from a doctor. I included it in my book. The doctor testified the only way a baby can talk to me during labor is through their heart rate. If there's ever any concerns about your baby, it starts with their heart rate. Again, because they're hiding inside your uterus. That's the best way to figure out how the baby's doing. There are so many decisions made based upon the baby's heart rate. So I've been a big advocate about parents get an idea of how to read your baby's heart rate. I mean, is so important. Heart rate's so important. It graphs next to your bed. It graphs at the nursing station. The doctors can review it remotely, wherever the doctors in the house are hanging out. They have their own little area. It graphs there. I mean, it graphs everywhere because it's so important. But they always want to keep it to, we got it, don't worry. And I'm like, no. So I have a whole chapter in my book on exactly what you need to know to read your baby's heart rate. Or if your grandma and your daughter is there, or your sister, maybe you have a sister that's going into labor, or just a really close family member. I mean, if you have somebody there who knows what that heart rate means, it is so important. Again, let's say the unit's busy and baby's heart rate starts getting funky. I've had cases where the unit was so busy, they just didn't realize it. And then it was, it's too late. Again, babies can be, minutes from being healthy or whatnot. So that's, for me, is definitely one of the biggest lessons, is to, take that time, take that hour, take that 2 hours. It's whatever it takes, and just get a good understanding of what that is. Now, mom, listen, you're going to be in labor. You're going to be focusing mentally and physically on delivering baby. So I would suggest, and I do have a chapter in my book on this, getting a baby advocate, husbands, time to step up to the plate, or, you could have grandmas, friends, whoever. And I go through, hey, this is what you should know. But one of those is the baby's heart rate. And so that way, maybe, mom isn't just staring at it or whatnot, but you have a second set of eyes on the baby's heart rate, because that really is very important. And in my cases, it usually all boils down to the baby's heart rate. So it's very important to understand. So I'm really hoping that there is like this shift that, like, okay, medical community's like, you know what, Gina, you're right. Parents should understand this. That way we can all work together. I think, but until that happens, I think a lot of these mistakes and complications will still happen. But if parents can get up and learn, I would say, another big lesson is learning and preparing for childbirth, and that being part of it will definitely help parents make those great decisions and have healthy babies.
So much in what you just shared that is incredibly important for parents to know from an awareness and education perspective. But I want to also pick up on what you just said there, which is essentially nobody wants to imagine anything bad happening during this time, the miracle of birth. However, how do you position it such that having this information prior to giving birth is actually ultimately going to help alleviate some of those fears? How do you go about taking the fear element out of it for parents to empower them with this knowledge?
Fear is the unknown. The only way to overcome fear is to understand something. So my book is also not about what can go wrong, but it's about how to make sure it goes right. So chapter 1, I go through all of the lessons for the baby cases, from the baby cases. These are lessons from the delivery team, the doctors, the families, but they're what's in my head, I know stuff and whatnot, but a lot of it stayed in my head. And when I wrote like the lessons, so for instance, lesson number 1, which is a huge lesson, which I just touched on, it's learning about childbirth. It's having an understanding of what you're walking into so you can make those good decisions and have streamlined communication with your delivery team, and that's a lesson from the families. They, unfortunately, they would just roll up to the hospital and just say, okay, I'm here. Okay, what do you recommend? And then all of a sudden they go into deer in headlights mode because they're giving all these options and they don't know what to do. And when you look deer in the headlight mode, that means that that's the element of surprise. And when you have that, there's no focusing. So listen, this is like the one of the biggest days a mom, a family, they dream of these days when they're going to have their first baby. The last thing you want to do is go into deer in the headlights. But the problem is, it's a mindset that I think we're all guilty of, and just bad things happen to other people. And you don't, as a childbirth attorney, I have done this for 21 years. Please do not have that mindset walking into one of the most powerful and biggest moments of your life. That if you're like me, I would, when I was a little girl, I would hold my baby dolls and dream of this big day. I dreamt of that day my entire life. So make sure you're ready for it. I mean, everybody plans for everything. And think about it too. Again, as I said earlier, decisions. Families are one decision or minutes from a healthy baby. Do you make good decisions when you have knowledge? Or do you make good decisions when you don't know what the heck's going on? I'll tell you, the families in these cases, the hardest part of my job by far is sitting down with them, talking to them about the day they lost their baby. It's very difficult. And when I sit down and I talk to the families about that day, they know so much more in the aftermath of losing a baby that I know in some of these cases, if they would have known this beforehand, they wouldn't be talking to me. So I cannot, as a childbirth attorney, emphasize enough. Listen, based upon what I've seen, how I would prepare my children for childbirth is completely different than how a family would traditionally prepare because of what I have seen. So what happened is, and how I wrote my book is, I started writing this stuff down for my kids. We had my niece who, so there was like an event in my family that kind of was my, stop me in my tracks mode. And we went about 20 minutes not knowing if her baby was going to be okay. And her baby was the first baby of our next generation. It was a very exciting time for all of us. And when we went 20 minutes without knowing if baby was going to be okay, I'm like, wait a minute, I got to start writing down. And we did get word that baby was going to be okay. It's actually the introduction to the book because it is why I wrote the book. And then that goes into my kids. Like started to write this stuff down for my kids. Like if you're going to have Pitocin induction, this is how you're going to do it. If you're, and so forth. These are the common mistakes in case mom wasn't around, or whatever, I wasn't around for the birth of their kids. So I'm trying to come full circle. You love my long-winded answers, right? I'm like, okay, here we go. I'm full circle on that one. But no, I wrote this book. As I started to write everything down, I knew that what I was writing down would not only help my kids, but families like literally around the world have a healthy baby. So for instance, like lesson 1, learn about labor and delivery. So that's lesson 1 in chapter 1. Each lesson is a subsequent chapter. So you go to chapter 2. And it is what I find important about labor and delivery, what I find important about childbirth, that parents, if they know and understand this, will give them that good foundation, will give them a great foundation to, make those good decisions. But the book is definitely, listen, I've been doing this a long time. It's in the book. I kept a lot of my happy stories in the book because people do approach me a lot. I get lots of calls from labor and delivery, from families, friends of friends, friends of family. Those stories are probably more of the ones that are included in the book because they all have a happy ending. But I learned early on, talking to somebody who was pregnant, that if I used language that was scary or whatnot, that basically they shut down. And sometimes what I'm saying is so incredibly important that, for them to have a healthy baby, that's the last thing I want to do. But last thing on the fear, scary part or whatnot. So I wrote the book. It took 14 months, thousands of hours. I focused a lot on not making it scary and making it more powerful and learning and whatnot. So then at the end, I gave it to 6 pregnant beta readers. So beta readers, they read your book beforehand and then they answer questions. So readers, before it was published, read the book. And the number one question is my book scary? Are you scared? What do you think of this book? Would you read it? Would you recommend it? and whatnot. And all six of them were like, no, this is great information. We're not scared. Every parent should read it, type deal. And then it was great. My last beta reader, not too long ago, finally she had her healthy baby. So I'm like, okay, well, all my beta readers had healthy babies. So, but no, they did confirm, and they were pregnant all across the board, from young with first baby to a nurse mid 40s with, second baby, to somebody in their 30s with their third baby. So second baby, they were just a good variety of, ages and babies. So, but they were like, no, this is not scary at all.
Gina, I'm curious as to what do you want parents, expectant parents, whether it's first time, or second child or whatever, to realize? What do you want these parents to realize about the power that they have to ensure a healthy and safety labor and delivery?
That's an excellent question. It is so important for parents to understand, especially moms, that they are the decision maker. The doctors, the delivery team, they're making recommendations, but they are the medical providers. So when they're making recommendations, it's very, important to listen to what they're saying, to asking and whatnot. So doctors, also picking your doctor is extremely important, because really in the end, it is, your doctor heads your delivery team, and your doctor is typically not even at the hospital until you give birth, unless they pick up a, 12-hour shift. But having a good relationship with your doctor, having a doctor that you trust and that you like and that you have good communication with. So listen, if you pick a doctor and you're like, wow, I do not want to ask my doctor this, or, he's very intimidating, they're very intimidating, or you don't get warm, fuzzy feeling or anything, those are red flags. You might want to consider, depending on your situation, if you can't finding, maybe a different doctor. But a doctor, because they are not at the hospital during childbirth, you're the rest of your delivery team, nurses, midwives. But let's say the nurse is they are giving, that's the person who gives like the direct patient care during it. And then they usually are the ones contacting your doctor, if not, a resident. But the point is, like, if your doctor doesn't have good communication with you, they probably don't have good communication with their delivery team. So be really careful. So it's just really important to make sure you pick that good doctor. I think chapter 4 is in my book is how to pick the good doctor, because I've analyzed OBGYNs, the doctors who deliver babies, at that point, 19 years. And I'm like, you have to do your doctor analysis, during your pregnancy. And this is what you have to consider. These are the questions you should ask, or at least have answers to, just to make sure that you're on the same page. But your doctor is so incredibly important in helping you make good decisions. And remember how we started this podcast? What shocked me the most from getting into this field? The different opinions that doctors have. I mean, Pitocin management, a doctor may read my chapter and be like, that's how I practice. What? And another doctor is going to look at it and be like, what is that? Because they're so incredibly different with their opinions. So picking the right doctor who aligns with your thoughts or your opinions or how you feel is so incredibly important. And then, like, learning about the childbirth, having the good doctor, and working together, you should be sitting pretty. And again, I would be having husband get involved. I get a lot of labor and delivery nurses who keep telling me that the husbands sit in the corner playing Candy Crush. And I'm like, what? They sit in the corner and play Candy Crush? So I'm trying to get over that one. But if I hear that one more time, I'm going to start putting stuff out on social media about it. But yeah, no, I think definitely that's huge. Learning, good doctor, all together working, and you guys will bring a healthy baby into the world, or at least avoid the complications and mistakes that I've seen.
We should mention that your book came out in 2023. It's called A Parent's Guide to a Safer Childbirth. Gina, I'm curious, you talked about a baby advocate. You talked about one of the things that a baby advocate should know is, about the fetal heartbeat and all of that. three other items that you think a baby advocate should absolutely know? And how else can a parent be tangibly involved in labor and delivery?
Parent meaning mom or dad?
Either or both.
Oh, okay. Okay, so number one, baby advocate needs to understand the baby's heart rate, like you just said. We've already been through that extensively. Number two, baby advocate must understand the common facts and issues in a legal baby case. And there are also a lot. So, for instance, in my chapter, chapter 11, it's not like any other chapter you'll ever read or find anywhere else. People keep asking me in podcasts, why is this information just surfacing? I'm like, I don't think a childbirth attorney ever thought to write a book. But these are your common mistakes. So if your baby advocate understands these, again, they're going to have that heightened sense of awareness. It's going to help activate their intuition because you don't know what you don't know. So your baby advocate, and not only that, in that chapter, while I identify a problem, I tell you how to fix it, how to make sure, for instance, Pitocin induction. If you want to have one, that's fine. That's your decision. I'm going to tell you how to have a safe one. Busy labor and delivery unit, I'm going to tell you what to do. The book goes through what to do in every situation to make sure these complications and mistakes don't happen to you. So they need to go over that chapter 100%. And then something we haven't talked about yet is I recommend, and I have a chapter on this, on what you need to consider for it, having a birth plan. Listen, though, my spin on a birth plan is completely different. It's the act of preparing the plan. That's what's the most important part of it, in the comfort of your own home, calling whoever you want, researching, reading my book, listening to podcasts, and then I tell you the different things to consider. And not only that, understand that childbirth is very unpredictable. So you need to be able to pivot and whatnot. So having that birth plan and preparing it, but then also going over it with your baby advocate is important, because if your baby advocate, you guys do have to, you want a Pitocin, something happens, you have to pivot, you and your baby advocate are on the same page. So, if you in your birth plan, you're like, I don't want to vacuum, I don't want forceps. If there's really big problems with baby, I want to go straight to C-section, just for example. Your baby advocate knows that. So if your baby advocate's like, no, you should do forceps first, you guys can duke it out beforehand, do whatever you want to do. But the big day is, you guys will be on the same page, because again, being in labor, it's the only time in life where being in a bunch of pain is okay. So some moms, well, I shouldn't say some moms, but some people keep telling me also the labor bubble, like, you're just kind of like, you're mentally, physically focusing on delivering baby, you're in a different state of mind with all of this pain. I had one doctor testify, and again, I included it in my books. I thought it was so important. He thinks all options should be given to mom before labor, because she does enter a different state of mind. So either you're in a bunch of pain from contractions, or you're medicated so you don't feel the contractions, and you have this baby in your belly. And, I've had 3 kids, and I remember always looking down going, oh boy, here we go. Anyway, so number 3, the biggest thing that I recommend with your baby advocate is that they understand your plan. But actually, I'll throw in one more thing. Another thing I go through is just being able to communicate. Listen, delivery teams, they are trying to deliver your baby safely. It's important that, when you talk to them, even if you disagree, maybe you're firm, but you are kind, you are nice, because ultimately, as the baby advocate, if you're out there and they see you as an ally trying just to help the team, they're going to treat you better. They're going to be there for you as much as they are for mom. And I go through that actually, in my book, because that introduction story kind of shows, it demonstrates that. But yeah, just having good communication skill, and I go through that, what that means in my book.
There is so much more to talk about. We've just scratched the surface of this topic, but you've provided so much food for thought. Gina Mundy, lawyer, mom, author of A Parent's Guide to a Safer Childbirth. Thank you so much for your time and perspective today.
Oh, thank you for having me. That was a great conversation. Even though I felt like I did most of the talking, I still enjoyed meeting you and being on your show. So thank you very much.
Thank you.